Hi, I'm Dr. Mandy Wyant of Family Chiropractic and Wellness, and this is Lauren, our chiropractic technician. Lauren's volunteered to be my model today while we talk about different neck and shoulder conditions and how we can treat those. So for most people, we find throughout the traps, so these muscles kind of all along the top of the shoulders here, usually quite a few trigger points and areas that can be causing pain. Usually from day-to-day activities. A lot of our patients work on computers all day long, and so like right there on Lauren, she's got a pretty good one in her right shoulder blade neck area, and it also usually more common on the dominant hand side. This area right here can give you pain that you feel across the shoulders, also can cause some symptoms and issues into the arms like numbness and tingling, but it's also a big headache trigger point for most people. So that's the area where we can do, just like I'm doing right now, some trigger point work, where it might be a little tender, but it helps get that muscle to release. And then we usually go over stretching and things that the patient can do on their own too, to work on that area. Moving up the neck, right up under the base of the skull is probably one of the biggest problem areas that we work on for a lot of patients. Like for Lauren, I can feel right there is tight and probably a little sore, because that's a big headache point. Most people think their headaches are something else. They tell me all the time it's sinuses, hormonal, weather, all sorts of different reasons, but this area right here under the base of the skull can refer a headache that you feel through to the eyebrows or through to the eyes, across the forehead and into the temples. They usually refer forward, so most people think it's sinus, but it's actually coming from the neck, and that's where we can work. So to work on that area, right up under the base of the skull, we can just do, again, some nice trigger point where I'm just kind of holding that tight muscle, trying to get it to relax and to release. I do find here muscle work really helps accompany the adjustment to allow everything to stay feeling better longer. But that usually starts to affect, when it gets tight, rotation, so head movement, usually looking over the shoulders gets limited, and that ties into what we tend to feel in the joints more so, in the upper neck. So to work on joint motion, that's where we do the adjustment. So I'm going to demonstrate, right, so right there on Lauren, I feel a little bit of swelling, an issue at the joint. So I'm going to demonstrate a manual adjustment. This is really just one option as far as techniques go. This is what most people think of when they think of the chiropractor. But again, I have a lot of patients that don't like manual adjusting, or they can't relax with it, so we use other techniques. But Lauren always does well manually. So we're going to go right there, and it's really just a light little thrust. It's just right there, and that's it. And then adjust it well, and that just gets some movement into the joint, gets it moving better, gets the inflammation out. And she also, I thought, one more spot right there. Okay. Now, usually for her then, we'd go over again things she can do on her own. If there's posture or ergonomics that need to be addressed, we go over that. But she adjusted well, and she should feel better.